September is National Suicide Prevention Month. It's a topic that many try to avoid, but tonight we're on your side with mental health experts that can help you or your family deal with the issues that lead to suicide. News 19's Andrea Mock is standing by in our phone bank where we've been taking calls since 5 o'clock this evening. I'm sure things are very busy there, Andrea. It's a difficult time for a lot of people.
You know what, Darcy, it has been really busy, but that's exactly what we wanted. It is so hard sometimes to make that first step, which is reaching out and asking for help. And that's exactly what we want people to do tonight. It's free advice. Please call the number at your bottom of the screen. I was just chatting with Helen before you came to us, and she said that 40% of people who eventually commit suicide show a warning sign to a coworker. I thought that was so interesting, something that you might not think about at the workplace, Helen, but what are some of those warning signs that we can be looking for in our friends and our coworkers?
Well, 90% of people who die by suicide have a diagnosable psychiatric illness at the time of death, most often major depression or bipolar disorder, a substance problem, schizophrenia, or a personality disorder. And then you've got PTSD, post-traumatic stress disorder, eating disorders, those kinds of things. But a person who's and most people who have these conditions do not make suicide attempts. But for the ones who do, you're going to see certain changes in behavior that will create interest. You become more worried, more concerned. They might express more problems sleeping, eating, more emotional, could have rages or outbursts, might start talking about having a plan. They feel desperate, they feel hopeless. A friend of mine who works in mental health says the voice of depression is a liar. It will tell you that your situation is helpless, it is hopeless. And they might start taking more risk, more impulsive behaviors, and actually have a plan and start finding a means, a way to end their life.
And Helen, you said there's an event coming up that you want to make sure that everybody that's watching is invited to.
Yes, the Out of the Darkness Community Walk. Your visible presence and participating in that walk on October 14th in Riverfront Park, your visible presence says, I care about this subject. I care. I want to save lives. This is the 10th leading cause of death in the United States, and we can all address the stigma that gets in the way of people asking for help. The military has a program, ACE, Ask, Care, Escort. Anybody can remember that. If you're worried, may I add one more thing? If you're worried about someone, ask the question. Care. Let them know that you care. Let them know that you will stay with them till help arrives. And if you're in immediate crisis, you can call 911. If it's not that high, you can call the 1-800-273-TALK line, or you can take them to the hospital emergency room, but stay with them. You can save a life by understanding these premises.
And listening and being a friend. Thank you so much, Helen. We're going to let her get back on the phone. Darcy, back to you.
Andrea, thank you so much.